Welcome to this episode of MetaWell. And this episode, we're welcoming Dr. Scott Noorda. Scott, I'm going to give an introduction about you in just a second, but welcome, and we're glad you're here with us.
Thank you, Adam and Cecil. Excited to be here with you.
Well, for those of you who don't know Dr. Noorda, let me just introduce him a little bit. He is a family medicine physician and has done some additional training in functional medicine, which in a minute I'm going to ask him to explain what functional medicine is, because some of you may not know. So, Scott, you can be gearing up that that's a question I'm going to ask you. But one of the things that he really focuses on is the brain and brain health, but also overall health and longevity. One of the really cool things that he and his wife Amy have done is that they have written a book together called Power Couple Habits, which is a really good book. So if you haven't read it, you should read it. Um, and I'm not saying that just because he does mention me and my wife in that book, which took me by surprise when I read it. Um, but it is a really good book for how couples can live life to the fullest. So you should check it out. Scott, is there anything else you want me to say about you before we just jump in?
No, Adam, that's great. Thank you. Appreciate
Yeah,
it.
of course. Scott, I gave you one tip. I'm gonna ask you, what is functional medicine and why should people care about it?
I think in the future, the question will be, why did we not always practice functional medicine? Honestly, I went through conventional family medicine training and loved what I learned, but quickly realized as I was seeing more and more patients in residency and in practice that conventional medicine training really does prepare you to see a lot of people and diagnose and treat conditions. But ultimately, at the end of the day, it didn't help me feel like I was making a significant impact on people's lives and the trajectory of their health. I didn't know that functional medicine existed. I knew that there were some things that I didn't learn in my medical training. But when I found the Institute for Functional Medicine, I realized that it was the piece of the puzzle that was missing from my training, which was getting at the root causes of conditions. So just like when I take my car to the mechanic and it's making a weird sound, I don't want them to just tell me this is what it is and then like clean it out so it doesn't make the sound, but it doesn't necessarily fix the problem, right? I want them to actually do the root cause analysis, plug in the computer, find the root cause, fix those problems so that down the road, it's not creating additional problems. And that's what we do in functional medicine. Most people think that's what we do in medicine, but we really don't most of the time. And so the Institute for Functional Medicine and functional medicine training in general really kind of provides tools for doctors to both diagnose, but also to understand what's the underlying cause of your high blood pressure, your diabetes. For me and my passion, brain health, cognitive decline, any of those kind of chronic conditions. How do we understand what causes those? What's the physiological change that happens upstream that causes these downstream effects? And then how do we go back to that point and start to reverse that and sort of empower people to have optimal health? There
I,
you
I
go.
have a question. I mean, that's fascinating. I don't know if anything comes to mind, but do you have any examples of something that in your functional medicine work, how you would handle that and what you might see as a root cause compared to what a conventional setting what they might see and what they might be doing?
Yeah, for sure. Brain health is the biggest one that I see all the time, and maybe we'll dive way deeper into that in a minute. So I'll save that for further conversation. But let's say fatigue, for example, right? It's probably one of the most common complaints that people have.
I feel it
So,
every day.
right? So people who come to see us typically have bounced around the medical system, seen multiple providers. They usually start with their primary care doctor, who runs super basic labs and then says you're probably just stressed, which is probably true too. You just need to slow down, or you just need to get more sleep. All of those things are true, but the question it doesn't fix the problem, right? So then they say, okay, we'll refer you to cardiologist. Let's look at your heart really closely. So they do a super in-depth assessment of the heart, and they might find some things and say it could be due to this slight murmur in your heart. Let's do this. Could be due to your blood pressure getting a little too high. Let's give you this medication. So now they're on 1 or 2 medications. Then they're still feeling fatigued and maybe a side effect of one of those medications. So then they go to a neurologist because they're feeling kind of lightheaded from the high blood pressure medication. So now the neurologist does some testing and, if maybe finds something else or says, I think you might have migraines. Let's give you this medication. Now they're having a side effect of that and their fatigue's still there, right? And so it snowballs to the point where people decide, okay, this is not doing me any good. I need to see somebody who can figure out the cause of my fatigue. And then they show up to our office, and then we're going to just dive. I mean, the keys to understanding root causes are not actually that difficult, right? Most of the time it's truly listening to the person, digging deep into their story, going back to the time when the fatigue started and what was happening leading up to that point in your life. And maybe it was stress, but how do we kind of support the system? So what we do is that deep dive analysis into their story, understanding relationships and sleep and stress, but also things they've been exposed to and antibiotics. So for example, this same person, this was of course a theoretical person, but they may, I can think of multiple people who might fit into some story similar to that. And one of those who came in on multiple medications dealing with fatigue, what we ended up doing was diving into her story, and we started to peel back and take off medications and replace them with nutrients and food and lifestyle things. And eventually, after digging into her story and doing some treatments, we found out that she lived in a home a few years prior to her home she was in now that had mold, pretty extensive mold in the wall. And they didn't find out until they were moving out. So we did some urine mold tests, mycotoxin or mold testing, found she had crazy high levels, put her on an antifungal. We did use prescription and natural antimicrobials, used nutrition to help detox her. And within a few months, she started to notice the energy coming back. And so one example of many, but that's kind of a good kind of comparison of the two.
Well, before we started recording, we were joking about you should move to Georgia. Now I feel like you should, and I need all the tests. I need you to scan me for everything.
Yeah, we can do
it. Scott, one of the things that I'm wondering about is you didn't go into medicine, as far as I'm aware, to really focus on the brain and longevity. What kind of oriented you to that area of focus?
Yeah, I actually did in some ways. Out of my original kind of moment, well, I was introduced to health and medicine actually in high school through a sports medicine class. That's the only way that I could get my attention to something scientific, was to tie it to sports. And so I loved that part. And I was on the sideline with the football team and athletic trainers and all of that. And that's kind of where my initial interest in kind of the health side came in. And then just had certain people along the way challenge me to, well, if you like this, why don't you consider medical school? And at that point in my life, I didn't love school. And so I wasn't sure that was the route for me, or that I could even do that. But after my mission in Detroit and learning Spanish and learning to study and just building up my confidence a little bit, my initial kind of dive into the world of true medical school and medicine was an idea that I wanted to be well, at that time I called it a brain surgeon because I didn't even know what they were called, but a neurosurgeon was kind of my initial thought, neurology or neurosurgeon. And then that was the plan leading up to through the first 2 years of medical school. And then when I did my family medicine rotation, I really hoped I didn't like it because I wanted to do something I got paid well for. And family medicine and primary care actually was a really good fit for me. So that was kind of the trajectory I took for a while, and then came full circle after my dad was diagnosed with Alzheimer's. I had studied neuroscience at BYU. I loved the brain. And then that brought me back to the brain and kind of diving deep into understanding the brain and what's causing Alzheimer's disease, and are there ways to prevent and reverse cognitive decline?
In that, obviously, Cecil and I are doing this podcast about well-being. So much of medicine, and you kind of alluded to this before, so much of medicine is reactionary or taking care of symptoms or those kinds of things. Where do you see the role of medicine in promoting well-being? How does well-being and medicine interact with each other?
Are you saying how should they, or how are they interacting right now in our
I guess it's
medical
a good
system?
clarify. I suppose I want to know, how should they interact?
Okay. The idea of what happened in our healthcare system, I think, unfortunately, as pharmaceutical drugs became more increasingly available and were a blessing truly for a lot of people, and still are. At some point, the pharmaceutical industry gained a little bit too much influence, and so that kind of trickled down into medical school training. And the idea, we still get trained in anatomy and physiology and all the basic sciences, and we learn that kind of pathways and all of that. The problem is that we eventually evolved into, and I should also say that it's partly because of the way that we do research, which is good in a lot of ways. In order to do a truly kind of randomized controlled trial, for example, you have to have like something that you can test and something that you can test against, right? Well, in that process, all of the things that didn't seem as obviously scientific or rigorously scientific kind of fell away. So everything that was basic knowledge and understanding around nutrition and lifestyle and all those things kind of fell by the wayside at the expense of these medications that were held at a high esteem because of the scientific rigor that was carried out to do their studies. So with that as a background, now guidelines are developed based on what we see in the research. So instead of saying, okay, you have a hemoglobin A1C of 5.7, so you're in the pre-diabetes range, which means you should start doing these specific nutrition and lifestyle changes, and maybe taking some targeted supplements that research has shown for a long time is beneficial, but maybe not randomized controlled trials. Now they're saying, okay, metformin or these other medications are going to be beneficial. So you start stacking medications as soon as somebody qualifies based on guideline. So it was that guideline-based medicine that changed maybe the direction of medicine, and not necessarily that it's a bad thing. It can be really helpful. The problem is that everything that we get tested on, everything that we are asked has to fit within the guidelines. As we're doing, ongoing education and CME and all of that, it's all based on what are the guidelines, and all of those are based on prescriptions that we're treating people with. And so at some point, that idea of wellness maybe was replaced by this idea of guideline-based medicine, and that becomes really mostly prescription-based medicine. So we're promoting a longer lifespan, but not necessarily improving quality of life or longer health span. What should happen, ideally, is coming back to that idea of functional medicine to say, can we look at the basic principles that make up our health and well-being, like you described? That's going to be eating the right things, moving the right way, breathing the right way, including the right air, sleeping, connecting with others, controlling our stress, all of those things. Can we make that the primary prescription of every single person that walks into our office, and then have prescriptions just as needed to fill the gaps? And that, for me, is the ideal way to practice medicine. We can combine the two, but have the focus be on well-being and prevention. The problem is when you get into a doctor's office, they have 5 to 7 minutes often to see you, quickly figure out what's going on, and then make a diagnosis and move on to the next patient. They probably already have 2 or 3 people in the waiting room. And so it's hard in the system that most doctors practice to be able to really promote true well-being.
Thanks for that history. I think that's a really helpful thing, and I think we've seen a similar trajectory in mental health care. And so I think a lot of the people who will be listening and watching may not be physical healthcare providers, but mental health care providers. But I think that's a very similar trajectory that we've been on.
Yeah.
So it looked like you might wanted to add something there.
I agree. It feels like we've kind of like gotten stuck in just the healthcare system in general, both mental and physical health and all the avenues of it, gotten stuck in this rut of the expectation being that there will be some prescription of a medication for whatever the issues are. And I'm assuming through, this history that you just described is how that's kind of become the norm rather than taking a look at, like you said, the quality of life that you're living, the lifestyle that you're engaging with, how you're treating your body and your mind. I don't want that to be an oversimplification. But what I've also noticed is that it's very easy to overlook those basic things that you described. Like when you say sleep better, eat better, move your body and be physically active, that stuff sounds so simple and so obvious that I think it just kind of like breezes in one ear and right out the other. It reminds me of anytime I hear Adam say something to his teenage son, I'm like, that like will disappear in a second. He he literally won't remember that you said that in 2 minutes. How do you make this like potent treatment for someone when it's this basic lifestyle stuff? How do you really make sure it gets delivered and used and maintained?
Yeah, that's a key question. And that was a question that we asked ourselves a lot as we were starting practice. And it's one of the questions that led to that book that my wife and I wrote as we were trying to figure out. Initially, it was actually around this Alzheimer's disease idea and how do we take this mountain of research that's nutrition, lifestyle, and supplements, and all the things, and put that into somebody's lap and make it applicable and help them understand the need for it, that it's, that they can hold it in that high esteem like they do a prescription, right? And so that process of trying to figure out, number one, how do we make it kind of find the scientific backing so that people understand why it's important and provide a good explanation of what it's doing for fixing the problem they came in with. And then number two, how do we make it so that sometimes this idea of like, for example, we might do a 30-day elimination diet and take away like the top 10 pro-inflammatory foods or potentially inflammatory foods on somebody and then reintroduce it one at a time. How do we help them in a busy, crazy schedule, trying to manage a family and a job? How do we make that doable for people? Yeah. It's an ongoing challenge for sure. But what we found is everything that's sustainable has to be made into a habit. And so then we take, instead of saying, you need to change these 27 things, we say, okay, big picture, this is what's going on. Now let's distill this down into what do you do today? You change one thing today or this week, and then next week we're going to change one more thing, and you keep doing that and snowballs over time. So part of it is education and letting them know it's not a prescription. It's not even like ibuprofen where you take it and you feel a difference right away. But if you can buy into what we're trying to create longer term, you're going to feel a difference. And it takes a lot of reassurance, a lot of support along the way. So we gave education, we gave the reasons for it, we give the resources and reading and support. We give, another thing is when somebody's trying to access nutritional supplements, it's the Wild West of supplements out there, and people can get anything off of Amazon, and who knows what's in it, right? And so trying to give them the specific resource to say, here's access to the brand and the supplement that has research that's been vetted, and a link so that they don't have to find it, that you just click on it. And so it's just like going to a pharmacy, except you click it and it gets shipped to you, right? Mm-hmm. And then also having somebody follow through with that. So health coaches for us have been vital, and there have been so many research studies on that to show if you have somebody, a health coach or nutritionist who's there following up between visits, supporting, there to answer questions, that's also been key. So that's what we do. We just surround people with all the resources, all the information, help them to see this is science-backed, research-backed, make it as easy as possible, and then give them a person who can say, okay, here's all that information, and you have that little window at lunchtime I know you don't have any time during the day to exercise. Why don't you walk outside so you get some sun exposure and you're moving? And then each time when you have a break, you're going to get your coffee. Let's actually just pause and do one more lap around the building. So if you can take that research and then distill that all the way down to the individual and their unique situation, that's what makes it work.
Yeah, that kind of reminds me of like physical therapy. It seems to be kind of an accepted norm that if you're supposed to be doing physical therapy, you check in with, whoever the trainer is, the coach, and you follow up on those things if you want the results. And people seem to generally trust this is going to help my injury or whatever thing is going on for them. But if you say the same about like, you'll feel better if you sleep, you feel better if you eat a bit better, you feel better if you're physically active. I've directly heard people, even in therapy, say, but I don't feel like it, or it just wasn't a week for that, so I'm not going to do it. But it makes sense what you're describing,
Yes.
like having that constant contact and consistency and redrawing the bigger picture, making it simpler, health coaches who can check in on that. And really just this entire era of taking it very seriously. Like this is the medicine, is you living this kind of a way. What were you about to say, Adam?
Yeah.
Yeah, I think one of the things that I really appreciate as I listen to what you're saying is there's a huge amount of overlap in in what we do and how we think. And one of the things that I think we have come back to over and over in this podcast is there has to be like a deliberate, like conscientious choice. And I think sometimes in the world that we live in, we're looking for that like quick fix. We're looking for the like what's gonna turn this around as quick as possible. And I hear you saying this is a lifestyle, not a fix. And I think that's one of the hallmarks of well-being to me is wellness is something that you're just consistently moving toward. Um, and I think that's the exact opposite of, problem solving is like we're just checking this little box over here. And so I really appreciate that one of the things that you're saying, but I also really appreciated in some sense it's a comprehensive program in some sense. It's not like we're just going to I think so much of what you talked about in traditional medicine is that we're in silos. And I attend to this particular thing and you attend to that particular thing. And I think wellness is an integrated, you keep using the word system. Wellness is an integration of all of the systems and saying we're gonna do what's good for the system as a whole. I guess that leads me to a question of, and this is a fairly basic question, but I think it's maybe too big and too significant to answer in a short period of time. So maybe if you can't do it, you can't do it. But why should people care? If there are these short-term fixes, or if there is a medication that I can go on, or if there's if I can prescription stack, why why should I go down what seems like, on the surface at least, a harder everyday grind kind of a path? Why is that the better option?
Yeah. Sometimes convincing somebody of that is the trick, right? I think it's probably true of pretty much everything that we do in life, that the harder way is probably the better way. And so convincing somebody of that usually means like helping them to see how that specific principle has played out in their life. What I like to do is tie it to, let's say for brain health, the one that I do the most. I'll connect somebody to them and their story and their why. Like, what is the purpose of you living right now? What do you enjoy? One of the questions in our health journey questionnaire that we have them fill out is, what is your purpose? Do you have a purpose, and what is it? Surprisingly, a lot of people don't know what their purpose is, but it's fun to talk through that with people. But if you can connect it with like, even my purpose is to be here for my children, or to serve the community, or to serve God, or whatever their purpose is, then you can bring that back to, okay, how well, let's come back to brain health again. How well do you think you're going to be able to be there for your children if your brain starts to decline, right? And here are your goals to have a sharp brain, and you let them walk through that process. Here's my why, and here's why I want to be healthy, and all the specifics. And what would happen if you weren't healthy? What would that look like at the end of your life? Sometimes people need that practice of just understanding What does it look like when it's not good? What does it look like when it's good? And then say, okay, are your habits that you're doing right now aligning with the things that are going to get you to that point or not, right? So helping them to envision where that's going to get them. I know I'm speaking your language now as I'm saying this, that this is like what you do, right? For me, there's so much power in helping them to envision where they could be and then where they likely are going to end up if things don't change. And so if we can do that in a way that they create the story for themselves rather than me trying to say, like, a typical doctor's office might be, you're going to be fat and you're going to be ugly and you're going to die, like we don't want to do that, but helping them to see, like, you may not be able to connect with the people and have purpose and be able to do the things you love or move the way you like to. You love to hike. Let's keep you not just moving, but optimally exercising and filling your body with the things that needs to build muscle. And so if you can connect it back to their story, I guess that's the way that you promote wellness for the individual. And that looks different sometimes for different people.
That's really reaffirming to hear from a medical doctor. I mean, we've said some iteration of that a billion times for the past, I don't know how many years. And I think it's actually really, really true and really powerful, and maybe connects to something that's just, integral to how humans function. Is there's got to be some sense of purpose, some connection to meaning in doing these things that I will agree are genuinely difficult. It's hard to change the way you eat. It's hard to change your physical activity level. It's hard to change just how you engage with the world, especially if you've been doing it some other way, most of your life. I mean, you seem to be doing exactly what we're doing in some sense, though, we're not really professing medicine to people or telling them any kind of like professional medical advice. But we do connect to purpose and then directly connect that to then what changes do you make to be in line with that purpose? And oftentimes it is a lot of this lifestyle stuff that leads to them being, some better version of themselves, even physically. Yeah, so I'm trying not to waste all our time just geeking out on the connections between, stuff that you're doing every day and what we're essentially doing every day. But I do want to highlight that feels like that's an important part of significant change, no matter which field you're coming at it from, is people have to feel like there's some heart in it or something, right? Like it's easier to make a change as a mom or a dad doing it for their children's future rather than as a person with diabetes just trying to make a lifestyle change, or as a depressed person just trying to get out of bed or something like that. Like those are different hills to try to climb up. I kind of distracted myself from what my next question was going to be. Oh, I remember now. I was really excited to hear your work in neuroscience. And I know we're kind of running out of time. Adam and I always do this where we talk too much. So you've given us a look into the world of functional medicine kind of in general. What are you seeing in terms of neuroscience, in terms of what people can do and have done to improve their health in that specific area, since that seems to be something that you really focus on? And feel free to throw in anything else that seems to really stand out to you in terms of that work.
Yeah, this is what I feel like. This realm of neuroscience, prevention of cognitive decline, dealing with all the dementia and Alzheimer's. Alzheimer's is the 5th leading cause of death in the United States. We've done almost nothing over the past several decades to change the trajectory of these people's lives, right? My dad was diagnosed 11 years ago, passed away like 4 years ago now. That whole time, like through my training at BYU in neuroscience up till maybe 5 years ago, there wasn't really any change in the needle at all, despite billions of dollars poured into the neuroscience research, because of that idea of we need a randomized clinical trial to show this one thing treats this one condition. And because that wasn't happening and all the drugs failed, there was really nothing that could be done. And so that opens up this opportunity to say, if drugs don't work, what can we do that might be effective? And that's what led me to Dr. Del Bredesen's work at UCLA and the Buck Institute. And then since then, multiple groups have kind of expanded and just being able to show that there are actual nutrition and lifestyle changes, targeted supplements that can make a dramatic improvement in preventing cognitive decline in Alzheimer's disease. I was just preparing some reels and came across the Pointer trial. It's kind of the biggest lifestyle related trial for prevention of dementia so far, and showed dramatic decreases in cognitive decline just with this structured program of telling people what to eat. In that case, they ate the MIND diet, kind of similar to like a Mediterranean style food plan. And they were moving and they were connecting with people and they were doing brain training. And it showed dramatic prevention of dramatic decreased risk of cognitive decline, even decrease in those who didn't have the connection. Like the coaching really, really helped. That made pretty significant improvements. But even those who were just given a DIY program at home showed prevention improvements. And so, I think the research has grown dramatically, and yet the medical community just has not accepted that for whatever reason. And so it's my mission, it's my passion just to get out there and shout it upon the rooftops that there's something that can be done, because I had studied neuroscience in North Carolina. I worked in assisted living and memory care facilities. And so I watched the people's decline. I watched the family members just struggle. So many like deer in the headlights looks at me like, do something. I don't know what to do. Or this family member is out of control, or I can't take care of them, or I don't have the money to put them in a facility, or they're miserable. They keep falling. But it's just such a difficult disease to watch. And so because of that, I think it's been more of a grassroots kind of pushing people, asking for and trying things. And social media has taken off on all the things that can help with brain health. But then to put that into a structure and say, let me give you, because again, we can accumulate information, but to have it in a process was key for us. So we put all that information into our Brain Lift program. It took a few years of trying to, again, distill it down into, okay, here's all the nutrition you can do. How do we come up with something that's like really easy so that you know what to eat every time you sit down, right? Instead of like, I'm overthinking and I can't eat this and I can't eat that. And now I don't even like food anymore because I develop a negative relationship with it because of all the things I think are inflammatory. So we came up with the 5 F's of just focus on getting healthy fats into you, getting phytonutrients, isn't an F, but an F sound. Phytonutrients, like really colorful fruits and vegetables, right? Berries and dark greens and all those things. And being able to get in flavor, which is the herbs and spices, those antioxidant rich foods, right? And fermented foods, and then fish and other proteins. And so we tried to just take this big concept and then we distill it down into daily things that people do every day. And we've been doing this now for several years. And so it's fun to see then like the Pointer trial and other things coming out to say, if you follow something like this, you will dramatically decrease your risk of cognitive decline in Alzheimer's disease, right? The trick then becomes, how do you help people who don't have symptoms, right? Somebody like me, who my father passed away from Alzheimer's disease, I know genetically I'm at risk. I think that is motivating for sure. But there are just so many people in the population that feel like, okay, I'm going to start. I know that I'm going to dabble in these things I hear about on social media, but until they start to have symptoms, they don't want to do anything about it. And the process starts decades before the symptoms come. So that's where we're at in this world of prevention of cognitive decline, is now you already have the beta amyloid plaques and the tau proteins and all these things kind of built up. And now we're having to reverse that. And it takes work and consistency, and we'll see the benefits. And then as soon as somebody stops the program, it starts to slide back. And so it has to be a lifelong staying with this. And it really, we've seen reversal, we've seen improvements, we've seen prevention. It's amazing for those who are dedicated. And so that's what we created, was this process to say, can we hold your hands and walk you through every step of it and make sure that you understand it. And then you just hold on to this education and just keep doing it for the rest of your life.
Yeah, that's amazing. I was hanging on every word, and then you lost me with fermented foods, though. I will say, I'm so
What
willing
if you
to
only
eat.
do 4 of the 5
Yeah,
F's?
4 F's. How far can I go?
Still helps.
Adam, you look like you had something. I've said plenty.
No, I really just appreciate, again, kind of one of the things that's really amazing is there's these fundamentals, right? And it's just like things that you can do. But I also really appreciate that those fundamentals only are useful or only are helpful when you connect it to the why or the bigger purpose or what we would call like a desired outcome. What is it that you want it? What do you want your life to be like? I think that's a really important connection that sometimes we overlook. Is that I think sometimes people really focus on like, what's your why? What's your why? Without these nuts and bolts of like, what are the fundamentals? And other times people focus on
Mhm.
like, just do these 5 things, but there's no connection to, well, why are you doing these things? And so I think that integration is a really nice balance that we can probably, obviously it's going to impact, like in this case, physical well-being and brain health and those kinds of things. But I think overall, when we strike that balance of like know the fundamentals but know why and make meaning of why you're doing them, that also is going to like change the balance of why do we do these things. And so I think you just, without really overtly saying that, you just kind of reiterated like we need both of these things over and over and over again. So I really appreciate that.
Yeah, one
Um,
last thing I'll just
yeah.
say real quick was, you asked like, how do we help people to understand this idea of wellness? And so we teach them, we educate, we give them all the tools, all those things. But I do think that one key for providers, and I think we're getting better at this, is that we have to do it too, right?
Mm,
We have to walk the walk. And so I have so many still patients who come in who are like, this is so refreshing that you don't just tell me what to eat, but you're like showing me recipes and what your family's doing, and you're doing this. And I can see that you're exercising, and I can see that you're trying to take time to connect with nature and all these things, right? So I think patients feel empowered also to work with somebody who is doing the things that they're teaching.
mm, very good. Is there is there anything that we should have asked you that maybe we're ignorant and we didn't know we should have asked you, or that we just overlooked? Anything that we need to include that we didn't?
Probably not. I guess the one last thing is kind of this ever evolving world that we live in when it comes to information, right? And AI now. I think that it is a super valuable tool. I think that people are now going to have the information. Everybody pretty soon is going to have all the information that they need, right? And so how do we as providers, as support teams, how do we make sure that not only we're continuing to be viable and helpful, but how
Mm,
do we make sure that we're on top of the information? How do we make sure that we are guiding them through this just ocean of information that may, some of it's helpful, some of it might not be.
mhm,
I think that's where we're coming back to, always coming back to personalized medicine. And so I think as providers, I would just say encourage people not to get like overwhelmed or discouraged about the future that the direction technology is going, because I think it's going to be extremely valuable as long as we can then take that information and help people apply it in a personalized way. And so, yeah, for individuals who are listening, for providers, I think that's the key. Is we're living in a world that's now being so saturated with information at my fingertips. I can on my phone ask AI anything, which is way better than a lot of the things that Google gives. But being able to then bring that back into what does that mean for me? And again, yeah, tying it to your purpose and giving them steps to get there, making it personalized, I think is key.
mm, very good. Cecil, anything else you need to know?
Oh, give me another hour. Yeah, I could keep going, but for the sake of time for listeners, for Scott being generous with his time, should probably wrap it up. One tiny thing that really stood out. I mean, you said so many huge things, and I hope people do really listen in and take all those things. But I think one component to what you said too is to not get so bogged down in trying to perfect all of this. Because I think it's really easy for some people, especially certain personalities, to really obsess over and transform their relationship to this stuff, to really try to get eating, perfectly right, or to try to they just go so far with physical exercise or something like that, when I think this should be enhancing your life rather than dictating your life or taking over your life and turning into an obsession. And so it's something to have a sturdy but loose grip on, rather than something that, is really strangling you and keeping you from just being able to like eat, be fine, be happy, be healthy, be all the things you want to be, and have these things in mind and let this guide your lifestyle. So that's the one thing I would highlight. But I'm so appreciative of your time. I'd love to hear more. Maybe I'll read your book. I haven't gotten a chance to read that. So instead of chatting your ear off for hours and hours, I will definitely be checking that out.
Yes,
Sounds great. Thank you.
I just wanted to say thanks for being here. I think you've made some really important connections between physical and mental health, which is obviously important to us as well. If people want to know more about you, more about your program, what you do, how do they find you? What's the best way to find you? And obviously, we'll connect in the show notes too. But
I mentioned Instagram, so we do a lot of education and reels on Instagram. So Dr. Scott Noorda, and then our website, which is resolvemedical.us. So that's, yeah, you can find more about our website, or more about what we do on the functional medicine side, on the brain health and brain lift program side. And then there's a button there that people can click. And if you want to just even have a free 15-minute call and talk through your situation and see how it can help you, if we can help you, then we'll do it.
Perfect. Well, thank you very much for being here. Thank you for the work you do. We're excited that our audience gets to learn about what you do and how you do it. So thanks for being here. We really appreciate it.
All right. Thank you both. It was a pleasure.